Hey guys, so here we are going on again about the coronavirus, or they're trying to find a new name for it actually. There's been reports on that they're trying to find a new name because, yeah, it's actually, they're now saying scientifically it doesn't fit like the description, and 2019 NCOV is what they're also calling it right now. But yeah, they're trying to find an official name. There's lots of stuff going on, right? All kinds of developments. We got a bunch more people testing positive on the cruise ships. And you know what I mean? There's a lot of speculation flying around now, and rightfully so. People are starting to believe, that this is something more than what they're letting on, and they're waiting on data. And they said that. They said it bluntly 3 or 4 times in the World Health Organization, right from the Director General, right from the top, and they said, we're waiting on scientific data before we make any assumptions. And we need to do that, that's what he said, we need data. Even though we know it might be really bad or whatever we might know, we need scientific data to give to the rest of the world and countries of the world, so people can look at this, because you got to realize there's a lot of countries in the world, and not a lot of them are the greatest or in the most stable places politically or anything like that, right? So it's going to be hard to get people on board globally until there's scientific data. But I think everybody's going to start to realize now, now that these cruise ships, you know what I mean? We got 3 cruise ships now that are under watch. We got one that is confirmed with 61 infected so far out of 273 tests that were conducted. So the first 31 tests came back and 10 of them were positive. So that wasn't very good numbers statistically. And now we have another ship. They're going to be testing, and I think there's maybe 1 or 2 cruise ships that are circling off the coast of Japan somewhere because they won't let them dock. Now I think they probably might have went on somewhere else, who knows, but that was later on today that they wouldn't let them come into port. Because their resources are strapped already. They got 2 cruise ships in a port there right now, with suspected cases, and there's one, I think, in the United States somewhere, I think. But yeah, it's not top news anywhere, right? It's not top news. And here we go. Let's see this here. Scientist says coronavirus vaccine may be ready by 2021. So that's like, it's still a ways away. Robin Shattuck, head of the Infectious and Immunity Imperial College in London, told the news that his team was sharing information with teams and scientists across the world to race to develop, worldwide vaccine, workable, but that stuff takes time, right? It really does, and time is something that we really don't have right now. Yes, we know what's important. What's important is to get a hold of this. Yes, we know that, but there's very little information on this still. The World Health Organization, let's check out this latest situation report, February 7th. I think I got that open already. Yeah, it's right here. February 7th highlights. So there's no new countries reported cases in the past 24 hours. To date, there are a total of 72 states. Parties were identified to be implementing travel restrictions through official reports, official statements of the media, and there's also the World Health only received 32% official reports from the states and parties about their travel restrictions. So a lot of people are just shutting down, right? Because they're and that's some of these countries aren't really, wealthy either. And, it's not, they might not have the means of dealing with something this big if it ever took over, right, in a small country. And it could very well be that way. We might not have, it might not just be aware of this yet. There's so many small places that are very limited to communication. And if everybody got sick, well, it wouldn't be, it'd be a tough situation for sure. And it's going to be a rough situation for everybody coming up here. I'm pretty sure, you know what I mean? Like, we are well on our way to a pandemic. And right here we have the World Health Organization novel coronavirus situation report 18, and here they mention the pandemic supply chain network has commissioned a market assessment. So, you know what I mean? Like the pandemic supply chain network, the PSCN, those guys are involved. So, it's well on the way to a pandemic. They haven't officially declared that yet because they need more data. But we can see shit is hitting the fan, and we can see that these guys are shitting the bed. It seems like it, they give very circular answers and they dodge questions. Yes, they have to, because they got to be very careful what these guys say. These are the top, he's the general director, and you got the top people of the world right there addressing the globe. So in all countries, right? It's not just an address to the nation or people. Like, this is countries are a part of this meeting. So, and they're talking to the countries as well, and they give this in an open kind of atmosphere. So, but I'm sure there's a lot that goes on behind closed doors that we don't get to see too, right? So we got to take everything with a grain of salt at this point in time. You make your own decisions. So they do still say, well, right here, China, it's very high. And this is the World Risk Assessment, like the World Health Organization Risk Assessment. And this is, and they say regional level is high. The regional level is high. And the global level is high. But then you have people, like locally, saying, well, the risk is low. But if the global level is high, how can anything be low or even medium in it? It's the globe, it's all of it. And even they specifically say regional level is high. All right, and China is very high. Of course it is. But there's so much mixed newscasts, and everybody's just kind of downplaying it. They don't want to spark panic. That's one of the things that they try not to do. So let's go. There's something I got queued up here, and I want to just show you this. This is the president's coronavirus task force. It's probably, these guys are at the top of the game, and they talk a lot about money. They do, and about resources, and about the cost of doing this, and then they specifically say, well, we're not going to let cost get in the way of decision making. But I think, well, we all know that it is.
I think we should all be humble about is you can't predict these infectious disease outbreaks. So I can't make a prediction. What I can say in infectious disease outbreaks, time matters. A lot of time in humanitarian crisis, they grow to a point where then you necessitate intervention. In infectious disease, you kind of want to get in there preferably before they start, but at least when they do start. Once they get to such a critical mass, then it's very hard for the tried and true approaches of public health to make that impact. So I can't predict. I can say, though, we're on a close watch around the world to see is there another country that starts to get what we call sustained human-to-human transmission. We're going to see isolated cases all around the world. We've seen over 300 of them now. Right? But and maybe occasionally a human-to-human transmission. But what you're really looking for is when you get a sustained human-to-human community-based transmission. And obviously being on the lookout for where that occurs and then try to get the collective effort of the world's public health community to try to prevent a second China right now as we try to work to help China contain their outbreak that they currently have.
Well, they just circle talk, really.
Just to underscore what Bob said, but I think also in answer to the question that the gentleman from BuzzFeed asked about where is this epidemic going to go, the issue is we don't know. And any kind of prediction, I think, would be
Well, that's true.
ill-advised because we really have so many unknowns. But there are several possible scenarios. I mean, the best scenario would be that the Chinese successfully contain and we see a turnaround of the curve. We see no more seeding in the international areas. And we don't see the sustained transmission in those parts of China, in those parts of the world that have travel-related cases. That would really be the best scenario. The thing that could happen that we don't know, and that's the reason why we don't predict, is that A, they don't control it very well, or they do, but it gets seeded in a country that doesn't have the resources to be able to do the kind of identification, contact tracing, and isolation. And then you have, again, a sustaining of the outbreak. All of these are possibilities. So what we're doing is that we are, as we always say, we become somewhat trite, but it's the truth, is that you really prepare for the worst possible scenario. And then hopefully that we'll see the one that does bring an end to this.
Okay, so you prepare for the worst possible scenario. So you know what I mean? They got guns blazing right now. But they're like, no, you know what I mean? We're just preparing. You know, we're just preparing. And that may be. But I don't, you know, there's nothing to prepare about this. It's happening. You know, you don't want to panic the public. And most people will just lose their shit. They would. You know what I mean? And rightfully so. We got to take a look at some of the stuff going on down here. You know, like check this out. This is, and I don't care if you don't want to watch it, don't watch it. But this here video came out of China, and they're just forcefully taking people who are sick, right? Like they are going to extreme measures. And okay, before this starts, you don't need to hear the volume, but like they're, yeah. So, anyways, we'll get into this in a second. But there's a huge response right now. Like they're just pulling people out of houses because they got a hotline set up that if you rat on somebody and tell somebody that somebody else is sick, then you get money. Alright, and then they come and like that's what they're doing. So they got these hotlines set up, they got people ratting on everybody, and you know, if you might not like your neighbor, well, you call on your neighbor, and these guys show up in their business. You know what I mean? Like, I don't know, it's maybe some of them sick, maybe some of them not, but they're just, and I'll show you some other videos too, and you can tell they're real because, you know, they're all in like surgical quarantine stuff, and it is you know, it's Chinese people, so you know it fits the description, so I'm gonna go with it and say it's real. But yeah, we're just gonna skip ahead. But like, yeah, they're, you know what I mean, like these guys are going in, and there's a couple of people in this apartment, I guess, and like they're either sick or whatever, but they're going to quarantine, obviously, and they're going there forcefully. You know, there's the son, like he's just like a teenager or something. And they're just ripping people apart, right? Tearing families apart. There's a mother or somebody, you know. And there's a guy in here, and they have a hell of a time getting him out. But the video just goes on, right? Now there's it's crazy, right? I got another one where. Yeah, like they're fogging the streets up here. Like this is old. This is super old. This is weeks old. I've seen these. If they are genuine, yes, they are weeks old. And they sure seem genuine because they're showing pictures of this on mainstream media too, like fogging the towns and fogging the city. But this here's a quick clip of just, you know, all kinds of crazy shit going on there, and you got to look at it because and then realize like what's going down. Because there is shit going down. That's a body bag, by the way, and that is Chinese. Oh, there is Chinese writing on it. Like, you see that? It's Chinese writing, whatever. And they're all this color. You know, we're gonna see more later that the hospital, all this color. But anyways, they're like pulling them out of the houses, right? They're like taking people out, and like they're like, you know what I mean, that they're dying everywhere, and these people aren't getting counted. They're not getting counted because they're already dead. They're going straight to incinerators. Am I wrong? Well, what are you going to do with all those bodies? You can't keep burying those bodies. The morgues would never be able to keep up with it. Right? So you would have to use the crematorium or whatever. It's crazy. Alright? Let's go down here, you know, they're pulling them out. There's shit going down, everybody's so pissed. You know what I mean? Like, you know, like this is old though. This is like older video. And here's that other video again, taking people out of the apartment there. Just kind of skip through that. And like, they look legitimately real. Like, why would people be all dressed up in these fucking suits if there wasn't like a viral situation going on, right? They're all in masks. Like, they're coming to do a job and remove people and put them in quarantine. But they're not putting them in quarantine, they're putting them in camps. Like, but it's not like the medical camps like you've seen, no. It's not like that. These people are, yeah, you know what I mean? Who knows, right? But we probably don't want to know the situation so good. But yeah, they grab him, they take him downstairs, like he's fighting and freaking out. And like this guy, see this rip? You're gonna see this guy's rip in a few videos. Like he's going different places. Like he's been in a few videos, right? Unless everybody just coincidentally has a rip there and there. But he's exposed, right? If that guy's infected, he's exposed all over the place. You know, and then he fights and he's fighting. He doesn't want to go. I'm trying to put him in an ambulance. But that's not healthcare workers there. That's, you know what I mean? I gotta. You see the shit going down there, right? You see that shit, right? That's not fake. That's as real as it's gonna be, and everybody thinks like, well, you know, these videos, we gotta watch out for fake media. How is it fake media? How the hell is that fake? Those people should get Oscars and Emmy Awards, right? Oh, and they're like, and here again, they're like pulling another body out. I'll kind of fast forward it, but yeah, these guys up here again, you know, pulling out another body. This is a different situation. Like, you imagine how many, like, these guys be going 24/7. You think the body counts and the numbers and all those people infected are right? How do you know all that whole goddamn building isn't infected? You know, it would seem like it. The whole city. Millions. It'd have to be millions. Goddamn right, it'd have to be millions. You know what I mean? They're just hauling people away 24/7. I think that might have been the same. Oh yeah, look. You know, they're just picking people up, and they're all in like suits here, right? It's not just like a regular fucking day in the job where somebody fell down or some kind of regular accident. No, these guys are suited up. This is in China. You know, this is real, and these people are dropping like flies. This isn't the goddamn flu. I don't care what you say. Compared to MERS or SARS and all this bullshit, media's downplaying. And like, what is it? Maybe it, you know what I mean? This isn't anything like anything in the past. Like, people are just dropping in the streets, dying in their houses, like all the time, like by the thousands probably, right? And you know, look, you just got people just dropping in the goddamn streets. And like this, look, those are Chinese, like the Chinese ambulance. That's Wuhan. That's Wuhan ambulance, right? You know, it's not fucking fake shit. You know, and somebody went through a lot of goddamn time to, you know. And like, these people are all suited up in fucking suits. You know what I mean? People are just getting trucked off like all the fucking time, dude. Everybody, and nobody's really paying attention. Oh, it's fake news. You know, this is the Wuhan hospital. Alright? But these are old. These are old. These are old. I promise you. Nobody's getting in that hospital.
韩扣一元的啊，就这样，打了那么多天针，就是不受到支援，也不受到治疗，就这样死了，就这样死了。
Like, look, this person was, I guess, in the ICU, and they're just dragging bodies out everywhere. Everywhere, all the time. Yes, it's happening. And you got the media covering all this up. These videos got out. Some of them are getting out, but then they're like, oh no, those are fake. Fake. But there's certain people that have these, saved, and they keep circulating because they're trying to keep people calm. Of course you want to keep people calm. You don't want people seeing this kind of stuff. Everybody's going to panic. Everybody's going to shit the bed. That's why they bear, like, in the World Health Organization, we know, like, you know what I mean? But they're waiting on scientific data, and that's giving them a goddamn crutch right now. That's something to lean on. Like, they're just dead. And this here's the hospital that they built. This is the new hospital, apparently. Just always full of dead people. Or no, sorry, yeah, this here's a gymnasium or sports center they converted. Why would you need all these, like, thousands of bed hospitals, and then now they're starting to convert all the gymnasiums and all the rec centers and anything they can do, right? It's uncontrollable. There. It's way beyond gone. It's like, I don't know what it's like in the rest of the cities or whatever, but Wuhan, it's too far spread. It's too far gone. You can't stop it now. You know what I mean? This woman's like having a breakdown, like I'm sure all these people know what's going on, but like, that's crazy, eh? Is it real? Is it related to it? I don't know, but sure seems like it, right? Look at these numbers. It's all, you know what I mean? Anybody in there would have that. Anybody even going to visit. Or maybe they're not infected. Who knows? Maybe those are the ones not infected. I don't know, but it's still crazy, right? Crazy. No, it's just huge in there. I don't know what that is for. Yeah, you get it, right? It's crazy. Like, what is that? Is that like I don't know, dude. I don't trust China, but what the hell is that? You know what I mean? Like, I don't know. They're taking them by like transport truckloads. People, like, Wuhan community, like, it's China. Look at that here. It's China. But like, there's like some kind of sprayer. Like, what is that? That's like a snowmaker. Like, that looks like a biohazard fucking sprayer. I don't know. I don't know if it's supposed to fix it or if it's spraying it into the air. You know what I mean? Like, how do we know what the hell's coming out of there? Like, what is it? I don't know what the hell it is, but there's a lot of people dying. Like, that's crazy looking. And like, look at them, there's a bunch of them. Like, they're fogging the city with something. I don't know, disinfectant? I hope so. But what, you wouldn't spray a disinfectant like that, like, you wouldn't. I don't know, like, there's nothing you could do. They're like, is this like the chemical? You know what I mean? It's like, there's something, I don't know. But there's so many questions, right? But I've never seen no shit like that before. Like, that looks like it's built to like how do they build that stuff? Did they just have that ready to go? Like, that's kind of fucked. I've never seen nothing like that in my life. You know what I mean? And look at them, they're just going around just like fogging everything. Are they like, is that like something like they're just like, I don't know, dude. That doesn't look like something like that helps, if you know what I mean. Wow, like what is that thing? Wow, dude, it's like that's bananas. I don't trust that thing at all. They're fogging the city. Yeah, buddy. Yeah, I will. Check out this one here. I'm gonna stream this because I want to have copies of these. But you know what I mean? And I'll be right back in 5 seconds. There's another video where this guy actually was on the subway. Yeah. People are just dropping. All of a sudden, just dropping. Look, just dropping. Like people just falling. Like what the hell, man? This isn't anything like. You know what I mean? What do you think?
Fox News political analyst Ron Williams joins host Dave Anthony with a preview and a breakdown of the presidential race. Plus commentary from Fox News contributor and former Utah Republican Congressman Jason Chaffetz. The Fox News Rundown is a daily news podcast where we take a deeper look at the stories important to you. You can subscribe on your favorite podcast player by going to foxnewspodcast.com.
I'm Juan Williams.
I'm Jerry Willis.
I'm Bill Hemmer, and this is the Fox News Rundown.
Friday, February 7th, 2020. I'm Lisa Brady. As the coronavirus continues to spread, countries and companies brace for the economic impact.
We are seeing company after company after company already seeing the effect and warning investors about it.
I'm Dave Anthony. 7 Democrats running for president get the spotlight again tonight with the debate after the mess in Iowa and before the next contest in New Hampshire.
I expect that Biden has to be more aggressive. I expect that Buttigieg will be trumpeting himself now as a leader. And so Sanders has every reason to say he's a leader in this thing.
And I'm Jason Chaffetz. I've got the final word on the Fox News Rundown.
The rapid spread of the new coronavirus has not only sickened thousands of people, killing hundreds, it's impacting millions of lives, especially in China, where quarantines have turned whole cities into ghost towns.
Nobody outside, no trains, no subways, no cars going out on the road.
Jared Evans plays pro football in China's National League for the team based in Wuhan, the epicenter of the outbreak. He's now under temporary quarantine at a military base in California, one of the hundreds of Americans evacuated from Wuhan on chartered flights.
We definitely were in pretty much of a cargo plane, very comfortable. Everybody was wearing masks and taking major precautions, and some of the officials were in complete hazmat suits, checking our temperature every 24 hours.
As health officials search for answers to treat patients and try to stop the spread, a wide variety of industries are dealing with the effects.
Every item that you have in your house.
This element is hosted behind the countdown.
直接一个 side 倒的，你看这个横向去这个病情现在多恐怖！哎呀妈，多么恐怖！嗯，已经病到过恐怖了，好恐怖啊，好吓心啊！
跑那个哇！确诊了嘛噻？但是有疑似的呢。疑似的抓人。
他个坡道嘛得多3个，这他妈3个去，他哪？我把它抖下了底我就把它。到底做什么了？你自己。不要过去了，当微弱牛。
那是出这门已经封好了，我日你妈就能开这么大。叫他干啥？不是有那个标签吗？只能开这么大。他对呀，人出不去啊，小孩可以跑。我操！
我拿我手机可以吗？先上车！我拿我手机，先上车！我手机拿先上车！连个见到没？我不手机，先上车！不是，是的。好了，算了。我们是正常的那个怎么了？毛地爬来喽，毛地爬来喽，爬地来喽，毛地爬地来喽，毛地爬地来喽。哦，这水里电少啊，一个灵儿。这么年的才开做呢，前来只有3年的。
Normal gold hoarders. I'm gonna wiener them.
Any chests?
Negative. They don't have anything. They have a banana box with 18 bananas. I can take all their bananas, put it in the banana box. We can jack them for it. Not that that matters at all.
Yeah, I'll go start turning this shit in. Or you want to turn it tomorrow, as Piggy said?
I mean, we just turn it in where the fuck ever. I don't care.
Yeah.
Just play with Smokey already.
Yeah.
As far as I'm concerned, we can just fucking drop off that shit on this guy, dude. Give him some loot. We act like we're just fucking ripping him a butthole, right? And if he doesn't end up scuttling, we give him the loot.
I don't care. It's up to you. I'll come back right now.
I mean, what we have on our boat right now is chump change as fuck. Might as well just bring it to this guy.
They'd be like, what the fuck? Should we sneak all the loot on? I'll send the boat away. We tuck to see what their reaction is.
Yeah, we don't need to send it away. We can just leave it here and sneak it on.
I'm talking about our boat.
Oh. What do you mean? Oh, he's
like,
on the boat right now.
the
Okay,
fuck?
just jumped off.
Oh, he is?
Just roll the boat up. Let's load his ass up, and then we'll tuck and see what he says. And you're saying...
Okay, well, that was, sorry about that.
Yeah,
I was smoking a joint. But anyway, yeah. So let's go, back into some news. Anyways, there's a lot going down, right? Dream is healthy, good enough. Okay, so 5 more Canadians. Yeah, that ship's huge, right? I got some Japan newspaper here. Top stories. Not secure. War declared on mahjong tables. Oh, that's gotta be interesting. Video posted on social networking site Weibo captures police officer destroying mahjong table in a farmer's home. Captured on video. Well, let's check that. Guy comes in and smashes the table all up. Cool. A new war began raging in China. Police burst into a farmer's home in a dramatic raid that accuses the offender of putting lives at risk. Playing a game. Because people are not supposed to be close to each other. Going on there? That's crazy. Beijing. New war, yeah. Officer smashes 2 mahjong tables to pieces and crackdown on the spreading coronavirus. Quote, you may not regret dying, but other people want to stay alive, the officer wearing the face mask screams while wreaking havoc on the tables. Wow. No more dancing? Chatting. Such bans have become a common sight in China since January as police in various regions have prohibited people from recreational activities such as playing mahjong and dancing in a park. Law enforcement officials said such bans are necessary to prevent infection at gathering sites. Videos capturing police officers destroying mahjong tables were posted on the internet, one after the other. In some cases, police themselves post the videos to make the presence felt by the police. I could see that, right? Authorities in Wahoo district have urged residents to call police on your parents if they go to play mahjong. Oh my god, that's a quote. Call the police on your parents if they go to play Mahjong. That is madness. Snitching encouraged. Zhaojin City, Hubei province, which is adjacent to Wuhan, the epicenter of the coronavirus epidemic with the largest number of infected people. Officials on February 3rd issued a notice to residents about the serious consequences and punishment. If you develop a fever, you must call the government and report it before the day is done. If you don't, you will be held legally liable, the notice said. Another directive said all citizens must have body temperature checked. If you don't cooperate, you will be punished. So we can see why these videos are coming up, right? Why these crazy, over-the-top arrests for people like not wearing a mask and not, excuse me, not, or maybe they're dancing or playing games and they just roll in and just fuck shit up, I guess. They do. Authorities also encourage snitching, offering a reward of $1,000 yen to 1,600 yen or $143 for reporting a person who has a fever but fails to notify authorities. This is from Japan. This is the Ashani Sambi. And it's, yeah, it's right out of Asia. It's a local kind of thing. Watchful eyes everywhere. It's not just the authorities that have taken an extreme approach to health and sanitary measures. Neighborhood community associates and other residential groups have begun keeping an eye on each other. You could see how that could work out in a panic situation, right? Or anybody who just might not like somebody. Hey, they got a fever. They're not reporting. You know, you could say that of anybody. Can you imagine? And they would just show up and like, oh, who knows, right? It's crazy. It's crazy. Similar slogans and banners have been displayed in communities in other regions of China one by one. A visitor is the enemy. Don't open the gate is one such example. Wow. The visitor is the enemy. Craziness, hey? Yep. Let's go back. You know what? It's funny that the cruise ships are not in the news. Like, I mean, front and center on every page wherever you do a CNN covering or the world. Surfing champion dies at 20. Sorry for your. Like, where's the cruise ship? Okay, do we have to go to Asia? Like, actually Asia news? No, McDonald's gets tongue-in-cheek send-off. Latest on the coronavirus outbreak. Ships in there, maybe? No, evacuees from Wuhan. That is unreal. Like, where's this? No, oh, look, there it was up there in the corner. The tiniest little, like, you know what I mean? Like, there's probably thousands of people affected. And it's not even close to top story. Norwegian Cruise Lines bans anyone from holding Chinese bans anyone holding Chinese, Hong Kong, or Macau passport. Like, scientist says coronavirus, yeah, but scientists can say a lot of stuff they don't know anything about. And that's the worst of it. They'll have come out and said we don't know with this. Here we have CDC Director Robert Redfield emphasizes on the call that immediate risk to the American public is low. Wow. That's a step, considering, well, right here we have, you know, the most latest update, February 7th of your coronavirus update. And as you can see down here, it is high all over the globe and even at regional levels, and China is very high. So if these are high, and then this guy's saying, no, it's low. And this guy's the director of CDC. in the U.S. CDC, of course. At this time, the CDC does not recommend American face masks a preventative measure. Best thing you can do, blah blah blah. You don't know what don't know what you idea what nobody does, and it's just blown my mind. 5 more Canadians test positive. National Post, I guess. But no, out of 250 tests, let's say, people are positive. Well, there's 61, but there was 273 tests done. But yeah, Foreign Affairs Wizard. Yeah, and there's 2 other cruise ships out there that they want to dock. Out in wherever, out in the ocean. I think they might have. I don't know. They probably went to somewhere else and docked because Ken said they weren't. 41 positive tests, but they're not given the other number here. Why not say out of 200 and some tests of the 3,700 passengers? Excuse me. It's they don't say nothing in here about that it was only taken from. Okay, so it says Canadians were among the 41 positive tests identified in the last rounds of tests. How many, right? I know how many. Report. Yeah, but there it was 270 tests.
Jeremy Farrer is a global expert on infectious disease, and he's also director of the Wellcome Trust.
Blah blah. Here's how the coronavirus will change. Oh. Alright, enough. You can't go to China. But they're not showing numbers. They were showing the numbers the first day. Wow. I got them on stream. 41 passengers. Oh, there it is. Begun testing 273 people on board, including those with viral infections symptoms. Oh, 61 people tested positive out of the 273 tests. That is not good. The first 31 tests that came back, 10 were positive. Yeah, that's a big number. Huge. Like some numbers and see if they jumped. Not that these numbers matter. They're so flat. Kinda tried to cover it up. Oh yeah, I'm pretty big there, 34. Yeah, 719, she spiked again, yeah. Look at this, let's go. Canada's got 7 now. US has still got 12, but there's like 4 or 5 in quarantine, and 2 people that came off the flight from Wuhan were sick now. So they're in isolation, they're still waiting on testing. It takes a day or 2 now, but you know, it takes about 3 days to do an absolute, you know, lab analysis. Which, you know what I mean? Time, right? Have time. Not. You know, this is what right here, December 30th. That's when things should have been, you know, or yeah. Like, why wasn't anybody doing stuff then? The World Health Organization's just got a team on the ground in there. Oh, they don't know the situation, but they're gonna know, and I think they will, or already do know how bad it is. But you know, they can't say to the world, you know, because everybody start freaking out, right? First case in the United States, and this here is like the summary of all the medical, like everything, right? And they posted it up here on New England Journal of Medicine. This is published. This is peer reviewed. So this is as good as it gets. You know, he's a 35-year-old man presented to an urgent care clinic, Washington, with a 4-day history of cough and subjective. So on checking into the clinic, the patient put on a mask in the waiting room. After waiting approximately 20 minutes, he was taken, you know, like he could have infected people in the waiting room easily. Whoever took him to the hospital. Like, you know what I mean? Like, oh, it's just, right? Anybody who has this, anything they do, they could be spreading it. And they are spreading it. They are. On the physical examination, revealed body temperature of 37.2, which is like 100 and something. Blood pressure of 134, yeah, blah, 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 blah. Heartbeat, 110 beats per minute. 96% oxygen. And then after a while, his oxygen went right down. We had a history of nausea, vomiting. Reported he had no shortness of breath or chest pain on day 2 in the hospital. On days 2 through 5. There we go. The patient's vital signs remained largely stable apart from the development of intermittent fevers accompanied by periods of fatigue. The afternoon, day 2, the patient had loose bowels and abdominal discomfort, blah, blah, blah. They tested his bowel samples, and it did test positive for the virus, but it remained negative in the blood sample. That's huge. So the stool and both respiratory specimens later tested positive for coronavirus, but the blood didn't show up. So that's, you know what I mean? It's tough to find. Yes, different stages and, of infection. You know, I'm sure somebody who's, you know, advanced, it would probably be more predominant and easier to find. But yeah, and then the chest taken on hospital day 3, illness day 7, reported showing no signs or abnormalities. And then on hospital day 6, a 4th chest X-ray showed bicellular streaky opposites, both lungs. Yeah, so he was starting to get pneumonia, which is basically Your lungs are filling up with fluid. They put him on oxygen. His oxygen on day 8, patient's clinical condition improved. Oxygen was discontinued. Yeah, but yeah. So discussion, our report of the first confirmed case in the United States illustrates several aspects of this emerging outbreak that are not fully understood, including transmission dynamics and the full spectrum of clinical illness. Our case patient had traveled to Wuhan, China, but reported that he had not visited the wholesale food center, or any healthcare facilities, or had any contacts with sick people during his stay in Wuhan. Although the source of his infection is unknown, evidence of person-to-person transmission has been published. And no secondary cases, but this is older. This is the first case, but there's lots of cases now, right? There's 12 officially on paper, probably 1,200 or 12,000. Like, we don't know where this thing is, right? And it's constant spreading, and they're just not doing nothing. They're not doing a damn thing. They're waiting on science. They're waiting on more data before they make actual announcements. This isn't a common sense decision. They have to have data to show other world countries, so they can be on board with the decision too. They just can't come up and say, hey, be a part of this, but we don't have any proof that it's happening. So they're stuck on the data train, right? But I think these cruise ships, it's gonna really show people what it is, and everybody knows what it is, or I do. You know what I mean? So that's something that we don't want. That's just that. Yeah, that's the way to put it. China's urgent plea for face masks. A shortage of medical supplies for face masks, especially, and just protective clothing for people. iPhone maker Foxconn starts making masks, right? We got a technology giant that makes computer chips and all this stuff, and they're retrofitting their assembly lines to make masks. Electronics giant Foxconn, maker of Apple iPhone, is turning the unusual step of switching parts of its production to making surgical masks, because they can't export any, right? They can't. All these masks, they're not going to come out of China. They're staying in China. They won't be able to ship these anywhere because there's no shipping going on. So they can't get masks in there, really, because there's not available in the world anywhere. And they're charging ridiculous prices for them if you do get it. If they do have some. But yeah, big stuff, right? And we all know that it's just a bunch of baloney. Listen to what this guy says about how much they know about it. He's the Director General of the World Health Organization. Now, this was February 4th, but it's still relevant because, they still haven't.
Today I have 3 key requests for member states. First, I call on all member states to share detailed information with WHO, including epidemiological, clinical severity, and the results of community studies and investigations. This is the responsibility of all countries under the international health regulations. Of the 176 cases reported outside China so far, WHO has received complete case report forms for only 38% of cases. Some high-income countries are well behind in sharing this vital data with WHO.
The director of the World Health just said, hey, we're not getting the data in. You know what I mean? Like, but we all know now with the time, Dr. Lee, he's the doctor that died trying to expose the whole thing when he did. But anyways, yeah. And we all know China covered it up, but they can't say, yeah, China covered it up because they have no evidence. Even though everything is like, hello, right? In the court of law, that'd be guilty. That'd be more than enough evidence, right? But this level, no, it's not even close.
I don't think it's because they lack capacity. They have to be cooperative. Without better data, it's very hard for us to assess how the outbreak is evolving or what impact it could have, and to ensure we are providing the most appropriate recommendations. Today, I'm writing to all ministers of health to request an immediate improvement in data sharing. As I said yesterday, we can only defeat this outbreak with global solidarity, and that starts with collective participation in global surveillance.
Global surveillance. You heard that, right? Yeah, you heard that correctly. Everyone's got to participate in global surveillance. So like these guys are using, they got measures in play right now. They have enacted certain protocols that basically you have nothing right now. Like nothing's ever was, but now they actually have the justification to go in and do whatever they feel like they need to do at any time they feel they need to do it. So just remember that, right? Anyway, and you'll hear that this first little bit's pretty interesting, and it speaks volumes.
The commitment to solidarity starts from sharing information. Solidarity, solidarity, solidarity. That's what I said yesterday. Second, we reiterate our call to all countries.
Okay, just 1 second. The girl or the woman on the right here beside him, I think she just sniffed her fingers. Totally sniffed her fingers. I just wanted to say that, but anyway, keep going.
Not to impose restrictions inconsistent with the international health regulations. Such restrictions can have the effect of increasing fear and stigma with little public health benefit. So far, 22 countries have reported such restrictions to WHO. Where such measures have been implemented, we urge that they are short in duration, proportionate to the public health risks.
Okay, and he's speaking to China here, saying, hey, like China's going to extremes here, right? Locking people down and throwing them into, like, quarantine camps and all this stuff. So, he's saying he's addressing China too. So.
And are reconsidered regularly as the situation evolves. And third, facilitate rapid collaboration between the public and private sectors to develop the diagnostics, medicines and vaccines we need to bring this outbreak under control. We have a window of opportunity. While the number of cases, more than 99%, are in China, in the rest of the world, we only have 176 cases. That doesn't mean that it wouldn't get worse. But for sure, we have a window of opportunity to act, because 176 in the rest of the world is very small. No reason to panic or fear. Of course, people can have concerns, and they should. People could be worried, they should. But that concern and worry should be supplemented with action now while we have the window of opportunity. And this is what we're saying from WHO. There is a window of opportunity because of the high measures, the strong measures China is taking at the epicenter, at the source. So let's use this opportunity to prevent further spread and to control it. Let's not miss this window of opportunity. Thank you so much.
Those are big words, eh? We have a window of opportunity. Let's not miss it. And at the time, he said there was only 107 cases around the world. And this was only 2 days ago. And what do we got? outside of China. Yeah, it's like 230 something now, or 40 something, and it just doubled in 2 days. Like, you know what I mean? So it's spreading relentlessly. And he says we got a window of not miss it, but same time in that current speech, well, he says that we need scientific data in order to basically make the next move. You know, they don't know anything on it. They have no idea. They're calling them on all the scientists everywhere, you know, that can have the resources or the capacity, and the staff to work on this. You know what I mean? Try to help the cause, because you know they have no idea what. And we have a cruise ship that's like going to be absolutely infested. You have no idea what the world is going to watch in another week or another few days as all these people start dying on this ship. It's going to happen. No cure for this. Remember, there's no cure. You might get better, but you still have it. In certain videos in China, when there was videos from the hospital, people were asking if it was your first or second time back. You know what I mean? Like, it's your first or second experience with this. They know you can get better for a little bit, but then it gets real. So, and they've known that. Like, everybody's saying, like, yes, okay, everybody's kind of gets sick for a little bit, and then you get better, and then you get really sick. It's absolutely mind-boggling, really, and it's a catch-22 situation. So you got to take your own self into consideration, and your own family into consideration, and do what's right from them. You know, everybody's in different situations, everybody's in different spots of the world. You know, but you know, you gotta take the appropriate actions, right? For sure, because the government isn't making a call on this till they say, hey, we got some fucking actual evidence. That could be months down the road. And you know, the planet could be burning around these guys. And they'll be like, well, let's just run some more tests just to make sure. I don't think it'd be that bad, but you know what I mean? Like, I think these cruise ships are really going to give them the data that they're looking for. Unfortunately, you know, if there's a silver lining in this situation, they're gonna realize how crazy this. And like, I've seen the videos, and I'm sure they've seen videos. Like, well, we can't make, you know, because can't make assumptions and evidence and science, and need more data. You know, numbers, statistics. Runs, you know, and it is, and they're weighing this against financial cost, and of course they are. They have to be. You know, if finances was a part of this, I'm pretty sure that right down already. I'm almost guaranteed it would. Oh, it's just like, and you got to think about that. Like, what if they do come up and just say, "Hey, everything's shutting down. Like, all cities are going to stay cities. Like, you know, like everybody, there's no movements. We'll keep the supply chain open for like meat, like food industry and all this, and but there'd be no eating out. There'd be no going out. There'd be no. You know what I mean, it'd be the same thing everywhere. You know what I mean? Or I don't know. It's gonna be crazy. You know how the world's gonna react to this. You know, because if we don't do it together, or maybe they're just gonna let this thing run its course. Maybe they know something we don't know. And, oh, fine. There's no way to stop this now. Oh, best thing we can do is wait for a vaccine. Now, do we tell everybody, or do we not? No, but we got 3 cruise ships under watch. One under quarantine that has guaranteed infected people. And then we have the other one. And February 7th. Oh, yeah. So the health ministry has confirmed that another 41 passengers aboard the cruise ship Princess Diamond at Yokohama port are infected with the new coronavirus. Following an examination of those showing symptoms that could match the infection, the Health, Labor, and Welfare Ministry found that 41 people tested positive for coronavirus. The number of confirmed infections on board has reached a total of 61 since the cruise liner arrived at port Monday night. After setting sail from Yokohama port on January 20th, a man who parked at his home port, Hong Kong, was found to have been infected with the coronavirus. Since learning of the infection, the ministry has begun testing the 173 on board, including those with viral infection symptoms. There's way more than 273 on board. Way more. They tested 273 people. Yeah, and 41 of them came back. I think there's like 3,700 on board this. No, the remaining 3,650 people, yeah, are required to stay on board the ship. 41 passengers who were also diagnosed with coronavirus Friday were to be taken to medical institutions in Tokyo. Taking them, oh, you know what I mean? Like all the nurses and all the staff are on fucking vacation there. Not vacation, but they're on strike. They did. They all went on strike because they're like freaked out with the coronavirus. You know, they all don't want to die either, right? Medical staff went on strike saying we're not properly prepared for this, and we're not, you know, which I could see like a lot of people not going to work. I sure as hell wouldn't. I don't know. I guess you have to be. You know, I'm not a medical person, so yeah, I don't have that. Yeah. You forgot to think about that, right? Like, would you go to work and you know that there was like 41 people just come off a cruise ship and they're all infected? Actually, 61 total now. So, like, there's 61 people. These are all people that are going to be going to ICU units. 61 people, like, that's probably going to fill most of their ICU units up. Oh, if they're not already full. Oh, like, that's just gonna... Like, look at that. Like, they're not like these when they're taking people out. Like, they got it all sealed up, right? Because you would imagine like these people probably don't want to go. Maybe, you know, there's probably going to be a lot of people that are old and really be like, get your goddamn hands off me, you son. You know, like how do you tell somebody that? They all know they're waiting for results from this crazy virus, and then oh, you got it, got to come with us. You know, like that. My God, I'm sure that's going over real well, you know. And as other passengers are watching them take people in and out, or not in and out, but you know, dude, like that's got to be wow, right? Just unreal. But there's going to be a lot more, I guarantee it. I'd say 1,000, 2,000. Like, I'm not. Like, just by the way this thing looks like it is, as infectious as it is, and it is, well, oh, you could definitely say, hey, and we don't really want to judge too much, but like, it's hitting. You know, if anything, I think I'm under, but you know, this thing, we don't know what it is. They don't know how it's being transmitted. Scientists have no idea. Really don't. And all they know that it's, oh, it's spreading, basically. That's all they really know. And they know people are dying. And it's affecting global economy. It's affecting global markets. It's affecting everybody locally. Gas prices went down here for the lowest they've been since I could remember. They're like $1.03 now. Like, and like, wow. It drops below $1, you know there's some shit going on. And you know why it's dropping so low is because nobody is driving in China. No planes are flying. All that excess fuel that's, you know, usually being bought by China, you know, 1 billion people. At least probably a couple of billion liters a day. So that's not getting sold anymore. Really, to get it in for one, and and nobody's driving, so that it's not selling. All the gas stations are closed, like everything's on lockdown. Well, yeah, have no choice but to stop like oil production in certain places as well. Other cruise ships. Thousands of people are being quarantined on 2 cruise ships docked in Japan. 61 infected. A third cruise ship has been turned away. Yes, a third one has been turned away, but there's also another one that's also another circling. That's what they reported earlier yesterday. Yeah, it's just there's so much misinformation from the media. There's so everybody. You got one people saying, "Oh well, based on our assessment, this remains low."
The immediate risk to the American public is low.
Is it? Okay, let's just go here. This is the World Health Organization. This is the real deal site. Situation report 18. It says global level high. Unless America's not a part of the globe. Yeah, so what are they saying? Right? And they even give a regional level here. No, even at regional level it's high. China, very high. It goes high, very high. So we are like second worst. Of course, just because of the amount of official cases. I mean, but do you think that people are going to start going to the hospital now if they get it like a cough or a cold or fever or something? Even if I don't know if I would. That's like, fuck that. I'll just stay home, even if I'm like, I'm just dying. I'll just because you can go there and let's say you only have the regular flu or whatever, and then somebody there has it, let's say in the hospital, and you catch it in the hospital. God. 2,000 recovered. They're all out of China, by the way. They're all out of China. Only ones are New South Wales, Australia. All the rest are China. 1,500 from Bay. We're like, but that's the symptoms going away. That's not recovered for this as of yet. That just means that their symptoms have gotten better. They responded good to or whatever. But we know that there's a second wave of this. You can get better. It's so different. It's symptomatic. They're all over the place. Nobody's displaying the same symptoms. Everybody's kind of got their own, but it's a little different with everybody. Gets you get in the bed. Of course they are. What the hell is going to be going into China right now? Unless it's in healthcare. Military tribute winning battle against the epidemic, and this was on the 29th. And the source is a new editor. I don't know. Well, it's Chinese here, but President Xi has ordered the Chinese military to keep its mission firmly in mind and shoulder the responsibility, make contributions, winning the battle. Aren't but at the same time, it is a common enemy now. This is going to affect us all. A lot of levels.
The this new virus may be more infectious than SARS. Super spreading events must be occurring, otherwise the number would not jump so high. And now we are seeing human-to-human transmission in family clusters and also in the hospitals. We have seen patients, especially children, who have a pneumonia but has no symptom of fever or cough, which means that it is not easy to recognize these cases of novel coronavirus infection, which makes the control of this outbreak more difficult. Once you start to have cases that has no connection to Wuhan, means that there are local chain of transmission happening, and that is extremely worrying. So it is very important for us to control it. Everybody, once you are outside your home, on public transports, to workplaces, you must wear a mask. You must do frequent hand hygiene and don't go near the hospital unless it's absolutely necessary. And of course, for healthcare workers, it's very important that all doctors and nurses must comply with infection control procedures. If the control measures are not working, or if the control measures are not being complied, then the trajectory could be very alarming. I just want to say that don't be complacent. We must treat it extremely seriously, because if you make a wrong decision in this stage in time, like what has happened in Wuhan, why not Hong Kong or other cities become Wuhan? Perfectly possible.
Oh, perfectly possible. And you have him telling everybody that you must mask at the time, but then you have other conflicting news reports saying, well, the masks don't work. You know why? Because there's no mask. And the frontline doctors can't get them. I mean, they don't have... It's crazy, the shortage of... Oh, it's just shit in the bed everywhere. You know, if this thing does break out loose on the West Coast, that's it. That's fucking... I don't care. There's no healthcare system. There's nothing that can support that kind of... They can't support it in China. They can't. It doesn't matter where this thing breaks out. Nobody. All the healthcare system in the world can't stop this. If it breaks out. Look, you know what I mean? Like, cruise ships, we're going to get some high numbers out of there. I think that's going to change the position on the World Health Organization's reaction. I think we're all going to be taking rub for a little bit, just I don't know. But humanitarian crisis of unprecedented scale is about to happen. Of course it would.
比较让我震撼的事情，这个我这位台湾的朋友去江泽民家去看江泽民的时候，他进去以后，江泽民呢，老人家用英文，不用中文，用英文跟台湾朋友讲：世界要乱啦，中国要出事儿，你们要准备点后路啦。
Neighbor of Wuhan person returning reported him. The reporter's throat was slit later. The guy ratted on him to get money because that's what the Chinese government's doing, right? And here's the workers building the hospital fighting. You know what I mean? It's just a shit show there. Whatever the government and whatever these people want to tell you happening, I'm sorry, but here's the real shit happening. You know what I mean? And this guy's from Wuhan, but he was in a different city, and they found out that he was from Wuhan, and people, and they're boarding people inside their houses who are from Wuhan. You know what I mean? And it's real. Like, look at that. Like, the whole places are, like, look, it's all roadblocked up. You got piles of dirt. Like, why would you go through those extreme lengths?
现在就像我在几周以前说的， 整个中国的这场疫情，接下来将形成人与人之间最大的一场仇恨的战争，就是共产党培养了70年人与人之间的自私、拉仇恨，啊，和对人的洗脑，养成的无知无畏，啊，那种暴力行为，和整个全民都是有心霾的这种情况，将导致人道大灾难。这是很恐怖的。这场人道大灾难，啊，正在迸发中，在全国各地。请告诉我，发动的是共产党，谁能停下来？一旦启动，没有人能停下来，就像这个冠状病毒一样啊，被共产党可能啊被共产党的解放军给放出来，或者是无意放出来，他能收回去吗？他收不回去了。现在整个全国上下人心里边又放了冠状病毒啊，这种冠状就叫心霾冠状病毒，大家自私啊、无知啊、无法了。随便打人，随便这个把人给关起来，随便封上门，这是犯罪呀！啊，所以说，亲爱的兄弟姐妹们，整个咱们这个14亿的同胞被共产党绑架70年以后，现在以最快的速度走向了人间的地狱呀！不但要走向人间的地狱，还要带到全世界下去，要把我们的在国内的所有的家人、同胞、同事们通通带走。我们现在能做什么？传播爆料革命真相，尽可能将国内你看到的、听到的真相发出来。
That's some crazy shit, eh? You real? I sure think so. You. If you don't believe it yet, you want to or not. Happening. Goddamn thing they can do about it. This is how it all starts, right? Trying to control it, trying to figure it out. But all that time, this thing is growing stronger, growing stronger, growing stronger, stretching further. We don't know. You got to take the time and at least prepare a little bit. Don't get a couple bags of Kraft Dinner, a couple of boxes, or goddamn life supply of them. Because I don't think they're gonna say, hey, sorry, we missed the window. I think they would say that, the whole world would go, well, we'll just keep playing it off, and playing it off, and hoping that it burns out or something. I don't know, I couldn't see them coming out. Like, well, yeah, you know what, actually, this is a show event. No, don't worry about it. Oh, good. Oh, you might be quarantined. And I think that realization for the people on the cruise ship, you know, some of these people going on a trip of a lifetime. That's it. Never see the outside again, maybe. And they'll be separated. It's not like these people are going to be together. Whoever they're with. No, these people isolation ward by themselves. And it has to happen, yes. But they shouldn't have brought them to. I really don't think that was a fucking smart idea. They should have took a different approach with it. But please. Fuck, there's probably 2,000. There's 1 point. Nothing of it. Don't let them tell you. No, this guy tried to tell. Right? Tried to tell the world and they arrested him. Arrested. No Chinese doctor died of the virus. Oh. What's China hiding? Why are they hiding it? Is it bad, but they're still doctoring it? No. And they ran out of money, ran out of and we're just throwing everything we have at it, and then that's all the less resources we have. What throw everything at China? What's left for the rest of the world to? Is China far gone? My opinion. Stop it now. Nothing going to turn into unimaginable humanitarian. Best thing they should prevent a lot anguish, suffering. Like it would be fire out, right? That bad? I think because it's an invisible enemy. It is stealthy and it is affecting. Happening. This is a news. They're actually spraying this. I don't know if that's actually disinfectant or the fucking virus itself. But I don't trust anything China's doing. I don't give a fuck. I don't.
China is on a war footing. Unverified video on social media shows streets in Wuhan, where the virus originated, being sprayed with disinfectant. But questions linger over how China's government is dealing with this invisible enemy. Few countries can marshal the resources now at China's disposal, and that's the thrust of the narrative on state-controlled television. But hospitals are swamped with an acute shortage of beds. Gymnasiums and sports stadiums have been turned into temporary medical centres to cope with demand. On Thursday, the death toll reached 565. The latest infections included a newborn baby. But China's government says the number of virus victims who are recovering is also increasing. Here in Hong Kong, the fear of catching this virus appears to be more contagious than the virus itself. On Thursday morning, there were reports of panic buying in some local supermarkets, with shelves being cleared of rice and other staples, forcing the Hong Kong government to say there's no need to worry, there's plenty of food. But there are not plenty of face masks. Those that are on sale cost 3 times what they did before the crisis began. People we spoke to don't understand why the government isn't providing them for free.
There are many poor people, they have to queue up to buy the mask, and I think the government should do more on that to solve the problem.
They are not doing enough because they did not plan ahead to purchase the mask for the citizens. Yeah, so now the prices for the mask is like going up.
The day after the Hong Kong government announced it would soon begin isolating all arrivals from the mainland, it remains unclear how that will happen. The 2 options appear to be self-isolation or being placed in holiday camps converted to quarantine centres.
Holiday camps? Anyway.
In Hong Kong, a luxury cruise liner, the second in Asia with infected passengers, is now a floating quarantine centre, as medical teams continue screening the 3,600 passengers and crew. The authorities are also appealing to passengers who were on a previous voyage to get in touch, fearing thousands more may have been exposed to the virus. Adrian Brown, Al Jazeera, Hong Kong.
That's crazy. What the? It's coming down, and I don't care. You can, oh, you can't get a handle. Why do you think? Well, the RO value on this is well, maybe the rest of the world. I don't know. Or not Japan. Ooh, I know. All but smoke and mirrors now. Five more Canadians on the cruise ship. It doesn't matter now. Canadian, U.S., Chinese, nationalities. Oh, no, these are people now. I guess, you know, in order to make them, try to put every table. Get 61, you get 30. Crazy. Others. The deaths are just rolling up. That's not. Can't get them any even if healthcare system smashed down. Now they're gonna be cruise ship. Like, what are they gonna do with thousands of people? Oh, like, like all those people. 61 come back positive. Big, right? We have no scientific data in the West. Like, it should have been. Oh, you still got flights going. Everybody's. I'm in the. But anyways, he's a slippery slope. Leave it at that for now, and I'll up later. Alright. This mess. Oh, no fuck. Green. But they can't really say, right? They're gonna be like, well, the world could be good, and this. I'll say it. I will. Yep. Anyways, watching, share. Stay safe out there.